Good afternoon, and thank you all for being here today. I want to continue to raise the alarm about the serious, deadly, highly contagious spread of COVID-19 in the state of Mississippi. As was said yesterday, and as was said last week, we continue to be in a dangerous position. The spread continues to be aggressive. Our hospital system continues to be stressed. I'm a pretty skeptical guy by nature, so I sympathize with the people who are still not on board with this mission. But I'm telling you, it's real, it's deadly, and it is getting worse, not better. And the best way I've seen to deal with it is to wear a mask as often as humanly possible. It's not fun. It's not convenient. But I believe in my heart it is much better than widespread economic shutdowns. And it's way, way, way better than widespread death. Please wear a mask as often as possible. I also want to share some information today on assistance for our cities and our counties. Earlier this morning, we had very productive statewide calls with members of Board of Supervisors, as well as with members of the Mississippi Municipal League, mayors, as well as members of city councils. We laid out this information in detail, and I'm going to ask Director Greg Michelle, who is leading the effort, to provide more information for you. The bottom line, the legislature did provide some money for local governments to help reimburse expenses. It's going to help defray the cost that they've incurred. Hopefully, it can help keep more people on the job and can prevent more layoffs. I know that it is not enough to overcome the terrible cost of COVID-19, but it is something. It is a start, and it is necessary. And we're going to do everything we can to get it out quickly and efficiently. As I said on the calls this morning, the Mississippi Emergency Management Agency is the right entity to do that. They have experience in the distribution of federal money. They do it every single day, every week, every month, and every year with Stafford Act money, and they are well equipped to do the same with this CARES Act money. So with that, I'm going to turn it over to Director Michelle and let him give you an update on this program.
Thank you, Governor. As the Governor mentioned, we did have calls earlier today with the Mississippi Municipal League as well as the Mississippi Association of Supervisors, and we've had calls leading up to that the last week. Through the efforts of our legislators, through Legislator House Bill 1799 and Senate Bill 3047, MEMA was allocated $70 million of a CARES Act fund to assist municipalities and counties to offset COVID-related expenses. There will be two tracks by which counties and municipalities will be able to apply for reimbursement of their expenses. As the Governor's already indicated, one of those is going to be through the public assistance venue. We are already established with that. We already have that system in place. The modules by which we do that, and for most counties and municipalities, it is no different in filing for public assistance through this process than they would through our normal natural disasters such as tornadoes, hurricanes, flash flooding. So most of the counties and municipalities are familiar with that process. That is 75% reimbursable from the federal government as it stands today. The additional 25% cost share match that is required for public assistance will be covered from that allocation of the $70 million for public assistance expenses. For those expenses that are not eligible under public assistance but are eligible under CARES Act guidance, then those expenses will be applied for through a different venue. That is a new process, and that is a process that we're putting in place right now. We're very close to having that online application process. It will look very similar to what we do with public assistance, but it must be new because it is a different venue, given that it is 100% reimbursable. It is important to know that counties and municipalities will not have the option of which venue they choose. If it is a public assistance eligible expense, they will be required to go and use that route. We've already got approximately 25 to 30 applicants that have already submitted project work statements, so we are already working those now. For those expenses, again, that are not eligible for public assistance but are eligible under the CARES Act, they will use that venue and that venue alone for those expenses. We do know that there will be some expenses that will be submitted that aren't eligible either way. Unfortunately, we'll just have to work those as we go. The tools that we'll be utilizing to help educate counties and municipalities on how to do that. We've developed some tutorials. Mallory's communication shop has worked together with my recovery director to put together some tutorials. We have that here in hard copy form. This is just an example of one of the tools. This will be posted on MEMA's website. All of the applications will be accessed through MEMA's website at msema.org. Go to our resources tab and you can scroll through and find all those resources there. One additional asset that we're going to put into place once the new application for CARES Act is there is a call center. So if you cannot get the questions answered that you need either online, then you'll have the opportunity to call a qualified group of folks who will be working a call center that will be located as part of our Joint Information Center at MEMA to assist you with answering questions along the way. Application process. The bill requires that the legislation requires MEMA to start making disbursements from that CARES Act not later than August the 15th. We will exceed that because, again, as already mentioned, we've already got applicants under public assistance now. So we will begin disbursements prior to that. The application period for the CARES Act, the application for public assistance is already open. It's been open since the beginning of this declaration. But for CARES Act, we will have that up and operational. It will open on August the 3rd, and the application period will run until October the 15th. One final thing to make note is that counties and municipalities, as directed by this legislation, will be allocated by population from the county and the municipality, will be allocated a set pot of funding. That was the fair and equitable way that our legislators decided to do that, and so your funding will be set aside and your draw either from your state cost share to match PA or from 100% reimbursement will come from that cost share allocation. One of the questions that I've been asked is, well, what do you do if a county doesn't use all their money or we run out of money? The answer to that question is after 15 October, if there's any funding available, we will do everything that we can to allow another allocation of funding to go out. But keep in mind, this takes time. We have a very short window of time, and our first priority is to process those applications through the initial application period. All this funding must be allocated and sent out by 31 November, and then that funding comes back to the governor for allocation based on his priorities. Governor, that's a quick 30,000-foot view of that, and I'll hold any questions at the end.
Thank you, Director Michelle, and thank you to your team for continuing to work diligently on behalf of the people of this state. I'm going to go to Dr. Dobbs next to give us an update, but just to lay the groundwork, on June the 27th, Mississippi had 490 patients hospitalized. This morning's report shows that Mississippi has 805 patients hospitalized, confirmed COVID-19. Over that time frame, we've gone from an additional 186 on June 27th as suspected COVID to today we have 254 patients in hospitals that are suspected COVID just awaiting a positive test. That means that we have 1,059 patients in Mississippi hospitals that either are confirmed or suspected to have COVID-19 today. That is by far the largest number of any time since March the 11th when we received our first case. It's real. It's serious. We are having conversations that we do not want to have on our next steps. The best thing that everyone can do is the little things. Socially distance, wear a mask in public, do the little things so that we don't have to, through government action, do the really, really, really hard things that none of us want to do. Dr. Dobbs?
Thank you, Governor. So today we're reporting an additional 862 cases with 23 additional deaths. That brings our total case count up to 37,542 and deaths up to 1,250. Along with the increasing cases, we're seeing increasing stress on our hospital system, as we discussed previously and well outlined by the governor. In the past 5 days, our total confirmed hospitalized patients in Mississippi has gone up 119 cases. Within the same 5 days, 40 additional ICU patients and 22 additional patients requiring mechanical ventilation. So we're seeing a pretty rapid increase consistent with our predictions, because we know when you have cases, you'll have people who get sick and hospitalizations. 17% more or less of cases will end up hospitalized. So every time we add 500 new cases, you can predict we're going to have another 85 hospitalizations associated with that. So it's just going to keep compounding. And we know when people go in the hospital for coronavirus, especially ICU, they have prolonged hospital stays. They don't get well very quickly. If we look at hospital capacity, today there are 10 ICUs in Mississippi that have 0 beds available. It's become a real issue, and I've heard some bizarre anecdotal stories about people trying to get access to medical centers transferred from ERs. They just can't do it, unfortunately. There are some regional variabilities, and we hope to have this up on our website very, very soon. If we look up in the northwest of the state, we are working on a system of care plan, similar like to trauma care and stroke and STEMI, such that we can divert patients efficiently to where resources are. And to that end, there is a system of care plan on our website if you want to look at it. It's a draft, and what we're working on will be significantly different. But the hospitals are broken out into Tier 1, which is UMC, Tier 2, which is our referral centers, Tier 3, which is our hospitals that have ICU capacity but are not considered referral centers, and Tier 4, they don't really have ICU capacity. And within that grouping, in the Jackson area, of the Tier 1 and 2 hospitals that are in Jackson, there is 1 ICU bed. Just 1. That's it. In the Tier 3 hospitals in the Jackson area, there are 6 beds. If we look up in the northwest, the DeSoto County area, there are 0 beds in Tier 2 hospitals, and there are 6 beds in Tier 3. It's not universally as scary on the coast. There are 11 ICU beds available in Tier 2 and 24 in Tier 3. But in like the Oktibbeha, sort of Columbus area, there are only 2 beds in Tier 2 and 6 beds in Tier 3. So it's really tight. There's a lot of challenges to the system. It is harming patient care, and it's not just COVID. It's very much people who don't have coronavirus. If you have a heart attack or a stroke or whatever, or pneumonia or whatever you have, if you don't have an ICU bed or you don't have a hospital bed, you don't have a hospital bed. 25 hospitals in Mississippi have less than 25% capacity, as outlined in the executive order, and 21 hospitals have less than 25% capacity in normal medical surgical hospital beds. Continuing challenge. We anticipate ongoing tightness within the hospital system, so we'll continue to work aggressively with our hospitals and work on our system of care plan. The only last thing I'd like to give you a quick update. There was a question yesterday about the outbreak at the Capitol. Right now we have 41 cases associated with that outbreak, and we are aware of 2 patients who are associated with that outbreak that are hospitalized. That's all I have today, Governor. Thank you.
Okay, we are going to turn it over to questions. I think this is probably the largest number of members of the media that are on our online call, so everyone know that we're going to get to you. I'm going to answer questions for as long as I possibly can. So with that, I'm going to open it up with Scott.
Governor, the Mississippi State Medical Association came out today saying that we should issue a statewide mask mandate. You've done 13 counties so far. Why not do a statewide mandate for masks?
Well, what I would tell you is that those individuals at the State Medical Association and I have the same goal, and the same goal is that we increase the number of people in our state that are wearing masks. We may not 100% agree on the best way to accomplish that. I know that every dentist I know wants 100% compliance for every kid to brush their teeth every single night. Some kids, if you tell them you have to brush your teeth, they just won't do it. It's just the reality of where we find ourselves. My view is, much like we have done in the past, much like we did in Leake County and in Attala County and Neshoba County and in Newton County and in Jasper County. If we issue orders that are specific based upon guidelines that we tell people about, for instance, the 13 counties that we have currently include those counties that have at least 200 cases over the last 14 days and or reach the threshold of having 500 cases per 100,000 residents. And so those are the ones that are most, we believe, that are most important. And we believe shining a light on those counties will help get compliance in those counties. The reality is that if we just issue a statewide mandate, there are going to be people in our state who say, well, I'm in Tishomingo County, and he just did that because things are really bad in Hinds County, and so I'm not going to necessarily adhere to it. Our goal has to be, how do we get the best, highest number of individuals adhering to wearing a mask when they're in public and ensuring that they maintain social distancing guidelines. And we think that the approach that we're currently taking is the best way to do that. I appreciate the opinion of our state's medical community. They are on the front lines and they are working hard. But I also will tell you that all of us have a role to play here. I need those in the medical community and those in our hospitals to adhere to our executive orders, which require 25% of capacity in hospitals to be for COVID patients. I need individual Mississippians and other parts of our state to wear a mask when they're in public. We need to understand that we are all in this together. We need to understand, as I said yesterday on social media, that we are not enemies with each other. Our enemy here is the virus, and we have to do everything we can to try to keep the virus from being spread, because if we don't, our healthcare community could become even more at risk. Gordian?
Governor, you mentioned that you all are having to have hard conversations about, what would be next if things don't improve. The Medical Association, they said, they think that's the last tool available. What is the threshold for additional measures or additional restrictions? I mean, we keep seeing things rise, so at what point do you have to institute more restrictions?
Well, we're continuing to monitor it. Our ultimate goal, as it has been throughout this process, is to ensure that every single Mississippian that can get better with quality care receives that quality care. And so we're going to take whatever steps necessary to make that become a reality. That includes slowing the spread, so that includes sacrifices being made by all 3 million Mississippians. It also includes sacrifices being made within our own healthcare system. There is no doubt that we have a scenario today where, and by the way, I want to go ahead and dispel another myth that seems to be out there. There is no healthcare community or healthcare hospital or healthcare provider that is getting rich off of COVID patients. They are a money loser. Okay, they're not classifying someone COVID so that they can get this huge amount of a windfall. But I also want to be clear with this. The federal government has provided $700 million to Mississippi hospitals to provide care for COVID patients. And the reality is that we have some in the system that, rather than treating patients, are diverting them to other hospitals. That is just a harsh reality of where we find ourselves. And that is not unusual. That is a system of care that occurs when we have strokes, when we have other types of patients. And I recognize that having a COVID positive patient, particularly one in the ICU and on a ventilator, is extremely challenging for facilities. But the fact is, we're all going to have to make sacrifices here, and we're going to have to continue to work to find ways in which to treat these patients. I'll give you an example. We have almost 700 ventilators available in the state overall. We've got about 120, which, by the way, is much large, almost twice as much as we had a month ago. We have 120 patients on vents in the state. So we have plenty of vent capacity, but we don't necessarily have the ICU beds available that we need. And so there are a couple things that we're going to have to do working with our healthcare system. We're going to surge ICU beds. We're going to have to take a step that we've already taken, which is minimize the number of elective surgeries that are taking place. And I can't tell you how many concerns and complaints that I have received from people across the state about that decision. The reality is, if hospitals had reserved the 25% for COVID patients that is mandated in our executive orders, we would never had to do a statewide elective surgical procedure mandate that had to be done over the last few days. And so I recognize that we're in difficult times. I recognize that we all have to make sacrifices. That includes folks within the healthcare space, but it also includes all 3 million Mississippians. Yes, sir.
This is for Director Michelle, actually. When it comes to the heat that we're going through right now, it's been a hot summer so far. What are your concerns over like heat-related illnesses and things as we continue on through this hot summer?
Well, I can speak only from the risk factor of the heat. We get into the treatment issues, I'm going to have to defer to my friend down here on the other end of the table. But we have seen very, very hot. You've noticed, I mean, we've had heat indexes, I believe Saturday or Sunday it was 118-degree heat index. So you heard me about 3 press conferences earlier ago. There's certain things that you really have to take into effect. And you know, masks only contribute to additional factors. When you got a mask, you're outside or you're with people, and if you're doing what you need to do, a mask certainly contributes to that. But you've got to hydrate. You got to stay out of the heat as much as you can. I worked last weekend out in the heat, and it even overcame me from the fact that I was not prepared for that. So you got to stay out. I would have to ask Dr. Dobbs at what rate the heat, you know, we had anticipated on the front end that heat would help the virus. We have not seen that be the case. But as far as the adverse effects and the heat's having on COVID, Dr. Dobbs, would you like to comment?
A scientific analysis has predicted about 20% drop in contagiousness. So I guess it would be 20% worse if it were cooler. So, I mean, there is some mitigating effect, but obviously it's not near enough to overcome the social behaviors that we've engaged in that has really promoted the spread of this virus.
Yes, sir.
Thank you, Governor. I'd like to go back to the schools real quick, if I may. So, you know, you have left it up to individual districts to open up. We have been seeing them unfold plans and release it. I guess it's a 2-part question. As a parent, do you think it's safe for you to send your daughters to school? Can you first say if you'll be sending them to school on a regular schedule?
Yes, I will.
You will? Okay, good to know. And secondly, what would be your message to parents who may be concerned about sending their kids to school? How can you tell them and assure them that it is safe, whether it's to school or college?
Well, we're going to continue to monitor the situation. We know that our kids have to learn. We have to continue to improve. We've got to make sure that our school systems are reopening in a safe way. We're monitoring and we're reviewing every new plan that comes out to make sure that they're doing that. The State Department of Health has put out guidelines on what can be followed. I think it's fair to say that there is risk in everything that we do. There is risk in driving a kid from home to school, either on the bus or in a car. There could be an automobile accident. And so I can't sit here and tell you that there's 100% of our kids can drive from their house to their school and not have an automobile accident and have a very bad outcome. I can't guarantee anything in the classroom that there will be no spread of COVID. What I can tell you is that there are safer ways to do it, and we've got to make sure that every single school district and every single school in our state has a plan in place where that is the case. I can also tell you that if you look at what transpired over the last 3 or 4 months of the spring semester in 2020, the COVID-19 did not treat every student the same. I have every intention of sending my kids to school in the fall, but I can also tell you they got a fantastic education because they had distance learning, they had devices, they had internet access, and they had teachers that were teaching. It didn't treat every single student the same because there were those that didn't have devices, there were those who didn't have connectivity. There were those who didn't have school districts that were teaching every single class every single day. And so I want to make sure that we are doing things in a safe manner, but I also want to make sure that our educational gap, which, by the way, this may be surprising to everyone, but our educational gap between Caucasian students and African American students, when you look at the NAEP testing results, is actually one of the smallest in the nation. And in fact, if you look at our NAEP testing results over the last several years amongst African American students in Mississippi, they actually outperform their peer group nationally. I don't want to see those gaps widen. In fact, I want to continue to see them to narrow. I want to see the absolute performance to continue to rise, and I want to continue to see that those test scores continue to improve, not only amongst some Mississippians, but amongst all Mississippians. And I believe the best way in which to do that is for our kids to be back in school. Now, there are other activities that are much less likely. If we continue to see increased number in cases, the likelihood you're going to have 5,000 people in stands to watch high school football is less and less. It's just a fact. Because we can't see gatherings of that many people because you get one or two positive cases in a group of 5,000, and what ends up happening is what you saw across the street at the Capitol, wherein you had one or two positives that turned into, what you say, 41 or whatever the number, I don't know exactly what the numbers are, but they can one or two positives can lead to a lot of cases very, very quickly in really large groups.
So just to clarify real quick, if I may, when you say you'll send your daughters to school, will that be 5 days a week, or will you do it like 2 to 3 days a week, then online learning? Do you know the plan?
I have not been told what the plan is at this time, but I can tell you that they will be wearing masks most likely, and if they get to choose, they're going to go to school 5 days a week. Probably in March they would have chosen 2 or 3 days a week. Today they may choose 7 days a week, but the reality is that they're going to be in school, they're going to be learning, and I'm hopeful that every kid across the state will be as well. Scott.
Governor, you're talking about peak ICU bed use, ventilators and such. Do you think it's time to start having people fined for not following the rules regarding masks and business capacity?
What I would tell you is I think in terms of those who are violating the executive orders, we've got to continue to look for ways to improve those who are adhering to the rules. That's everything from those individual hospitals who have not reserved 25% of their capacity for COVID patients. I mean, that was a condition of reopening elective surgeries, was that every hospital that had elective surgeries would have 25% capacity for COVID patients. Some of them did that, many of them did not. And so when I am called and said, why are we shutting down elective surgeries again? The answer is because the hospitals didn't do what they were supposed to do the first time. And it's just, I don't know any other way to put it than just to be honest with you. I've sat here at this table. I've expressed a lot of happiness when our numbers were going down and a lot of frustration when our numbers are going up. And I still experience those same emotions. But everybody needs to hear me say we have got to get our compliance up. We're not ever going to get 100% compliance. I don't have 100% compliance in Mississippi on our murder statutes, unfortunately. But we've got to do everything we can to protect as many Mississippians as is possible. Yes, sir.
This is actually for Dr. Dobbs. On that note, Governor saying that hospitals just broke the rules and did this, and then now we're seeing this increased hospitalization rates. Why were hospitals doing that kind of thing if that's the case? Why would they have increased their capacity?
All the hospitals have surge plans, and a plan on paper and a plan in action are different things, and we understand they have challenges to staff up those surge plans. We've been working with them closely, and a lot of them have been able to actuate those plans, and we're hopeful that so there's two ways to make hospital beds, right? You either make new hospital beds or you keep new people from coming in. It's a two-sided equation. And so we had to activate the side that kept people from coming in with the elective restrictions. But as hospitals look at their plans and add on additional capacity with their surge plans, we're hopeful to let them get back to full operations. But it's going to be a balance, and it's not, and I would, even if we can get back to doing the elective stuff soon, I'm not saying that we're going to have the same challenges again because the cases are continuing to rise. Every piece of this is connected. People getting sick in the community are stressing the health system, and then also causing nursing home outbreaks because it's in the community. So it's all interrelated, and we have to do everything we can, not only on the response side, but also on the prevention side.
And let me just be clear, to be fair, if there is 3 ICU beds available in a hospital, it does not behoove them to implement their surge capacity. The things that had to occur in New York City, for instance, wherein you may have more than one patient in one ICU room, so you could put 2 patients in an ICU room, they wouldn't necessarily be getting the same quality of care because you may have the same number of employees, but you would have 2 ventilators, so those are steps that can be taken, and we're not at a point now where that has been required. And so we may get to that point, though. When you go from the number of patients that we've seen in overall beds from 490 to over 800 over about a 15 or 16-day window, and the thing we know for sure is hospitalizations and total number of people in ICU beds and total number of patients on a ventilator, they're lagging indicators. What we're seeing in these new case numbers today, those are going to be hospitalizations a week from now, 10 days from now in a lot of instances. And so we've got to get control of the spread. We've got to be wearing masks now so that even if we tick up over the next week or so, if we can reduce the number of cases, then maybe we can look out 10 days and start seeing that number roll over. But we're not there yet. And so there's no doubt that there are other ways that we can get patients treated. It may not be the same quality of care because if you put 2 people in one ICU room, obviously, unless you double the number of staff, and that's hard to accomplish, then everyone's not going to get the same quality of care. And so there are other measures that can be taken, but what we can do, as Dr. Dobbs mentioned, in terms of reducing the number of non-COVID patients that are taking up these ICU beds and quite frankly, taking up staff and other things, again, we're not stopping procedures that have to be done to protect individuals. We're just delaying those non-electives. I think the original order only went into effect until the 20th or so of July. That's a health department order, and so Dr. Dobbs and his team will make the final decision on that, but we'll have many conversations about it, as you can imagine. There are a lot of different tools in the toolbox, and we've got to implement and utilize as many of them as we can right now to try to get as high a participation rate as possible, while at the same time protecting lives.
Hunter Jopkins with Gazebo Gazette has a question.
Renee, thank you. Governor, thank you. This is a double-sided question for you and Dr. Dobbs, Governor, and this will be coming from your numbers perspective and from Dr. Dobbs' scientific perspective. Explain to me your thoughts about the process of herd immunity coming from you, Governor, from a numbers perspective, and from Dr. Dobbs from a scientific perspective.
Okay, the way I described it yesterday, Hunter, is as follows. And I don't want to speak for Dr. Dobbs. He can tell you what he thinks it would take to get to herd immunity. Different experts have different views on exactly what that means. But here's the simple math from my perspective. If you believe, as some do, that to reach herd immunity, you would need 70 to 80% of Mississippians to have it. There are some who believe that, and I'll let Dr. Dobbs speak to it, and if his number's half that or twice that, I don't care, whatever he believes. So the way I look at it is this. If you believe it's 70 to 80%, let's say that number is wrong by half. So rather than saying we need 80%, let's just assume for a second, just because the math is doable, that really you only need 40% of the population to have the virus to have herd immunity. Now, many experts think it's twice that, but just from math perspective, let's say 40%. With 40% of the individuals in Mississippi having to have it, that would mean we'd have to have 1.2 million Mississippians that have had the virus. We are currently reporting approximately 37,000 Mississippians have had it. So what that would mean is To get to 1.2 million in herd immunity, we'd have to have 1,160,000 more Mississippians get it. Okay? To take that a step further, our largest day, I believe one day we've gone over 1,000 new cases. We would need 3 times that, 3,100 new cases for every day for the next 365 days, at which point we would reach that full 40% to reach herd immunity. If you believe that it's truly 80%, as many experts believe, then we would need 3,100 new cases every day for the next 2 years to reach herd immunity. We all want herd immunity to work. And oh, by the way, there's no guarantees at this time that if you get the virus, that you definitely can't get it again. That is normally the case, as I appreciate it, with coronaviruses. But it's also normally the case that the summer months help slow the spread of the virus. We haven't seen that. This is a different strain. This is a different virus. This is a different thing than anything that I think we as Americans have ever dealt with. And so with that, I'll turn it over to Dr. Dobbs and let him talk about his personal views on herd immunity.
No, and I agree with you entirely. The numbers, 70-80%, has been pretty good consensus number. And what herd immunity basically is enough people in the community can't get it, so you don't have ongoing transmission. It's like sort of like a prescribed burn for a forest fire. If you don't have enough sort of debris underneath the trees, you might have little spotty little fires, but they're not leaping from place to place. And so basically, there's enough immunity out there such that one person doesn't give it to 3 people, they may give it to 1 person, and over time it'll sort of peter out on its own. It's something we know works really, really well. But to get to herd immunity, the way we need to get there is a safe and effective vaccine. That's how we achieve herd immunity in the modern era. We don't have people, die from measles or die from, or have, paralytic polio. So the natural infection because of the severity of the illness would be absolutely intolerable to try to get there by letting everybody get sick. And if you look at what's happened in Sweden compared to other Scandinavian countries where they try to kind of do it in their younger population, they've had a lot more cases and a lot more deaths, but their economy is really no better. So, that's another thing too. It's a false choice between health and the economy. The wise choices support both.
And just to reiterate, 3,100 plus cases per day, every day, for the next 365 days would mean we may reach half of what many experts believe is herd immunity a year from now. That's 3 times larger than our highest day. If you look even today with our 7-day average, we don't have a 7-day average yet over 600 cases. Okay, we don't have a 7-day average yet. And so we would really need 5 times more every single day for the next 365 days to reach half of what many people think, many experts think would get us to herd immunity. All of that to say is maybe it's a goal, I guess, to get to herd immunity, but it's not a strategy. It is not a strategy to deal with the here and now. I wish there was a way to just snap our fingers and say, boom, we got herd immunity, all is good. We're dealing with real life, hospital beds, hospital capacity, ICU beds, ventilator use going up because there's more coronavirus in the state and in communities. There's also always the question, well, is our testing the reason that the numbers are going up? And I can't speak to other parts around the country. We have been a leader in testing. A lot of other states have started to catch up, by the way, to their credit. They were months behind us, but they have started to catch up on the overall number of tests of their residents. I believe we're at about 13 or 14% of our residents having been tested at this point. But the reality is that there was a period of time that it was hard for us to find people to test. In early June, nobody wanted to get tested because nobody had any symptoms. Nobody felt bad. Our total testing is now turned and it's starting to go up. But it's starting to go up because people are scared, because they're symptomatic, and because there's more coronavirus in our communities. Our positivity rate is way too high. We'd like our positivity rate to be at 1 or 2%. It's a lot more than that right now. And I haven't looked at the number today. I think it's 10 times. It's close to
I think it was 16% last that I
Yeah.
looked at it. So.
Dave Elliott with WOX has a question.
This both for the governor and Dr. Dobbs. This just came out about 5 minutes ago. The Mississippi High School Activities Association Executive Committee, some were expecting maybe moving football to the spring. Instead, announced the fall sports season is going to be delayed 2 weeks. Opening games for football September 4th. Nothing in here about rules regarding fans in the stands. But Governor and Dr. Dobbs, what do you think about that decision?
Well, I haven't seen it. I haven't seen the press release or whatever they put forth. I'll definitely take a look at that and can have a more informed comment once I see what they say. Obviously, in terms of the number of fans in the stands and things such as that, what is safe and what is not safe, we're going to have to monitor that as we go. We'll ultimately make a decision, but it is incumbent upon all of us to protect the public health, and I'm committed to doing that. So,
Likewise, we'll look at it. Certainly, there's multiple things involved with football specifically. You know, kids can probably play football relatively safely with some sort of precautions. Crowds are never safe right now, so that's a real concern. The other thing I think that we need to really consider is what do you do with a football team where half the team's on quarantine? Or maybe your quarterback's out, or maybe your offensive line is on quarantine, or half of them are sick. We're going to see that. And so there are going to be complications going into that we haven't really accounted for. It's going to be a very different fall than we're used to, no matter what.
CJ Lemaster with WOBC has a question.
Hey, Governor. Hey, Dr. Dobbs. My question, and I want to ask you, Dr. Dobbs, about this county-by-county summary information that's now available. I want to ask about that. Obviously, you see information on long-term care facility outbreaks and outbreaks outside that, but the vast majority are not associated with an outbreak when you look at the Jackson metro counties. What should the average person living here, take from that?
It means people are getting it from just being out. I mean, they might be picking it up at a store or a restaurant or at a party or at church. It's just everywhere, and we're unable to link it to any specific thing. It is a virus that is everywhere around you, and that's why you need to be very careful. And when I'm around anybody, I assume that they have the virus, and I think that we all, have to live our lives understanding that, yes, we can interact with people, yes, we can go about our business, yes, we can do our work, but we have to do it in a way where we acknowledge that everybody we encounter is a potential risk.
Jeff Hunter with Mississippi Today has a question.
Good afternoon. This is both Governor and Dr. Dobbs. Dr. Dobbs, you said, I believe, 41 cases related to the Capitol outbreak. Is that inclusive of lawmakers and staff? And earlier you had given a breakdown of that. Second part, that would lead to a question for you, Governor Reeves. The legislature has unfinished business with the education budget, the EMR. What's the plan moving forward? When can they come back? Would you call it back into special session, or what's the situation at this point?
if you don't mind, I'll just the situation is, like so many situations today, fluid. We have found a way to keep DMR open for now. We believe that the veto of the education budget was done in such a way where we protected those areas that were non-constitutional by keeping them functional and operational, and those other areas that are required by our Constitution, which the Attorney General's opinion gives the executive branch great latitude to fund. And so we believe that we're in a situation in which both of those entities can function. Is it perfect? No. Is it ideal? No. Should they have left without getting those done? No. But we are in a position in which we will bring them back at the appropriate time if and when it is safe to do so. I do not think it is I think public health must trump everything else. with respect to legislative action, and I know that we have been in contact with individual legislators over the last several weeks, and I am confident that working together we can get to a solution that makes sense. But I'm not going to bring them back and put them in harm's way. If 41 individuals that are associated with the legislature have received positive tests within the last 14 days, we've got a lot more time before we can safely bring them back.
And it is inclusive. Many of those are staff, but we're aware that at least 30 legislators have tested positive.
Yes, sir.
Thank you, Governor. We know Mike Pence, on behalf of the White House Task Force for the Coronavirus, is in Louisiana today. We heard some reports, I believe, of Dr. Birx coming to Mississippi at some point. Can you confirm if the White House Task Force, any members are coming to Mississippi, and what they'll be talking with you or your team about?
I cannot confirm. We're going to let the White House confirm what their members and people who work for them do. But I do expect that we will continue to have conversations. I was on a call with Vice President Pence yesterday. I believe it was yesterday. These days seem to be running together, but it was yesterday that Vice President Pence and as well as Dr. Birx and others were on a call. I would anticipate that it is certainly very possible that in the coming days that we will see officials from the administration in Mississippi. But I'm gonna let the White House either confirm or deny who that's going to be and when they're going to be here.
Melissa with WDAM has a question.
Good afternoon, Governor. This is a question for you. You continue to stress how bad the spike currently is and how much we need to do the little things, but you've also said that there's no way to enforce every person wearing a mask. If things just continue to get worse and worse, is there a certain number that it would make you put into effect greater restrictions? Is there a possibility of another stay-at-home order? Is there a certain number that would, jumpstart that action?
Well, thank you for the question. I hope things are well in your neck of the woods down in Hattiesburg. As I have said throughout this process, nothing is off the table. I am going to be very, very reluctant to shut down private businesses. We're going to work very hard to not do that, in large part because I believe that private businesses can be open and can function in a way that is safe for not only their employees but also for their customers. In terms of, are there numbers that would trigger additional restrictions? Yes, there are. If there is repeated days in which there are over 200 cases, new cases, in any one county, we could add counties to the executive order that we put into place yesterday morning at 8 a.m. If there are additional counties that have over 500 per 100,000 residents, we could add those counties, and we'll do so if it becomes necessary. We're monitoring those numbers every single day. We're not going to throw one on and take one off every day, so we're going to give this time. But what I would tell you is if you're concerned about more economic hardship, if you're concerned about more slowdowns and shutdowns, the best way to guard against that is for everyone to wear a mask in public. I do want to point something else out, though, because I've seen it particularly online. Everyone's a warrior in their social media platforms, particularly if they can do it in such a way where it's anonymous. But mask shaming does no one any good. It does no one any good for you to shame someone because they're wearing a mask. People should be wearing a mask. It also does no one any good for you to shame someone because they're not wearing a mask. Because I can tell you, those who are naturally skeptical and don't feel as if wearing a mask is the right thing to do, while I personally disagree with that, if you try to shame them, it's going to make their resolve even stronger to show you and to prove to you that they don't have to do it. And so the reality is that we're in unprecedented times in this country and certainly in this state, and I am just pleading to you to do the little things, to help us get through this, to think about what God tells us to do, and that is to look out for our neighbors. And every little thing that we can do right now can help our neighbors. And not only may help our neighbors, it can help our moms, our grandmoms, our dads, and our granddads. And so I am pleading to my fellow Mississippians to recognize that it is worse today than it has been at any time since March the 11th when we got our first case. That is undeniable. It's worse in terms of overall hospitalizations. It's worse in terms of overall number of patients in ICU beds. It's worse in terms of overall ventilators. It's not a time to panic. We're going to make decisions that help slow the spread. We should not panic, but we also should be very diligent in the way in which we go about this. And we need to look out for ourselves and look out for our neighbors. Renee?
Patrick McGee with Sun Herald has a question. Bobby Harrison with Mississippi Today has a question.
Governor, appreciate it. Couple of questions for you. Getting back to the education budget, and you touched on this, I think. Why did you veto parts of that budget you did, such as Chickasaw session, special education, deaf and blind school, and so many different things? And Dr. Dobbs, after the governor answers that real quick, I mean, speaking of budgets, is your state support budget enough to do what you need to do?
I'm going to answer both of those, and I'm going to let Dr. Dobbs answer the second one in the way in which he would like to. What I would tell you with respect to the education budget is as follows. Many legislators that I communicated with recognize that the formula, the MAEP formula under the bill that was vetoed, increased by $40 million year over year. It would take approximately $27 to $28 million to fund the school recognition program. Most legislators, those who support the school recognition program, and even a lot of them who don't necessarily support it, wanted the opportunity to come back in and simply move $27 or $28 million from MAEP, where the formula would still get about a $10 to $12 million year-over-year increase, back into the school recognition program, line item, and as it has been done certainly in years past, and that would give them the ability to do that. I could have taken the approach of vetoing the entire bill, and that would have given them the opportunity to do so. However, had I vetoed the entire bill, it is my opinion that some areas some areas that are not specific in the Constitution, specifically mentioned according to the Attorney General's opinion from years ago, and again, we're in uncharted territory, obviously. This is not something that anybody has ever done before or is used to, but we tried to do it in such a way where we could keep the core functions of the education institutions in Mississippi operating and functioning, while at the same time giving everyone in the legislature the opportunity to come back and do what they told me they wanted to do, which is to fully fund the school recognition program, fully fund the increased salaries for those 23,157 teachers who earned it and who deserve it, and that's the way in which we did it. With respect to the health department budget, I just want to personally speak to the flexibility or lack thereof that was provided by the legislature. It's not unique to the health department, but I think it's probably included in the health department. I won't speak to the numbers. I'll let Dr. Dobbs speak to that. In times like these, there are some agencies that need more flexibility. We need to be removed from personnel board restrictions. We asked, for instance, for agencies that report to me, for that flexibility with the Department of Corrections. We know that we inherited, when I came into office in January, a mess, an absolute disaster, quite frankly, from a total lack of leadership at the Department of Corrections. We need flexibility to right-size the administration at the department and we need flexibility to make sure that we can get more money to those frontline workers in the department that need it. The Senate passed that legislation. The House chose not to. I don't know exactly why they did. I think there was a similar bill for the health department. In these challenging times, in my opinion, the legislature ought to give each agency whatever amount of money they choose to do. That's their prerogative. But they need to give us the flexibility to actually operate that budget based upon what is in the best interest of the citizens that we serve. And so you can talk about your budget.
Thank you, Governor. Our budget's a complicated budget of about $60 million we get in state money. A third of it goes to other people. It goes to UMC, it goes to the trauma system, it goes to other people. And so we understand it's a tough budget year and people had to get cuts. And so we got a 3% budget cut, but it all came out of our end, right? So, 3% of 2/3 is more than 3% of the whole piece, right? So that was a little bit of a challenge. It wasn't quite that much because of some other funding. So we're a little bit disappointed in that, but we understand everybody has to go through that. One of the problems with that is our state, we have enough federal money for the COVID response at this time, so we're not really worried about that. But our state money, because the way things are funded, we can only use COVID money for COVID stuff, right? So we can't use, we need this money for TB treatment in the counties, for fighting syphilis and STDs and making sure that that women get pap smears, and the local level. We really depend upon that money for being out in the community and taking care of those gaps in the healthcare system for people who are most vulnerable. So we'll just continue to try to fight for that message in the future, and we'll continue to try to meet our mission as best we can.
Try to go back to Patrick McGee, the Sun Herald. See if we can unmute him. Emily with AP has a question.
Hi, Governor, this question is for you. You've made very clear that you think the governor does not have the constitutional right to limit church services, but you do have a leadership role, and given the situation Mississippi faces right now with the spread of COVID, is there any sort of message you would like to send to ministers or leaders of congregations about safety precautions in having in-person services?
Well, thank you for that question, Emily, and you're right. I don't believe that the governor has the authority to shut down churches. I believe they have a freedom within our Bill of Rights to open and practice their religion. But I do also believe that the vast majority of our ministers throughout the state want to protect their flocks, and they need to develop plans so that they protect their flocks at this time. That includes social distancing. That may include wearing a mask. Some of you may have seen, and I believe it was 3 weeks ago, my family and I were able to go back to our church in early June. We all had on masks. There were less than 100 people in the church. Our church is obviously played on TV here in central Mississippi. We really enjoyed it, and literally the church elders made the decision not long after that to shut the church back down to in-person services because of worries about the rising case number. Again, I don't believe that the government can shut you down. I don't believe the government should shut you down, but I do think it's incumbent upon all of us to do everything we can to help protect our fellow Mississippians. Yes, sir.
Going back to the education bill, some legislators were saying that there were opportunities to fix some of the problems that you saw with it. Why do you think it was important to veto those sections instead of letting lawmakers try to fix those?
Well, the lawmakers that may want to fix those will have that opportunity to fix those in an upcoming special session, and so we'll be able to fix that and do it in a way that protects those 23,157 teachers that I am absolutely committed to protecting.
CJ with WLBT has another question.
Hey, Dr. Dobbs, one other question about those county-by-county summaries. There appeared to be more non-long-term care facility outbreaks in Madison and Rankin counties than Hinds. since the pandemic began. Can you speak to the cause of those outbreaks in those counties if possible?
I'm not quite sure. I'll have to go back and look at the Rankin one, but I do know that in Madison, you know, it's the cases, not the number of outbreaks, the cases that are outbreak associated. And, you know, we did have a large number that were associated with poultry industry, and I suspect that's a lot of that. There usually be an industry or something like that. So I do suspect that, at least for the Madison especially, that's going to be a lot of those cases, but it could be for Rankin as well. But I can get with Dr. Byers and dive in a little bit more.
Dave WLX has another question.
All right, quickly, Governor, you know, you've been relying on voluntary compliance on the mask mandate, but if that isn't working, and it's not in many cases, it comes down to enforcement. So, I mean, is it up to the Walmart or grocery store manager, the minimum wage convenience store worker to monitor, demand compliance, ask people to leave, call the police? What do you say to businesses or local officials who just don't know what is required of them?
Well, I think what I would say to those individuals throughout the state, I think the executive orders are clear in terms of what individuals need to do, but there is no question that we have 3 million Mississippians. We don't have enough law enforcement. We don't have enough local law enforcement. We don't have enough state law enforcement. For instance, I've got approximately 500 state troopers, and we have 3 million Mississippians. They can't be at every business to ensure that everyone is complying. This is going to take a group effort by all Mississippians. It's going to require businesses perhaps to put a poster board on their front door which says you cannot come into this business unless you are wearing a mask. I don't think there has to be altercations. I don't think we got to call the police on every single person. I think that more and more people are complying. In fact, I came down to the Gulf Coast, the beautiful Mississippi Gulf Coast, over the weekend, and I really believe that I got there late on Thursday, and there were more people wearing masks on Saturday than there were on Thursday, and I think that's a good thing. I think as we raise awareness, the vast majority of Mississippians want to do right. And if we can get 70, 80, 90% compliance, it can make a huge difference in the transmission of the virus in our communities. A huge difference. If we could just get 40% compliance, it would make a big difference. If we can get 90% compliance, it'll make an even bigger difference. And that's what we're asking for. And I think Mississippians are going to step up, and they're going to do that.
Bobby with Mississippi Today has another question.
Governor, you said that, I think it's essentially say your ultimate goal is to make sure everyone who can recover with quality health care has that quality health care. I mean, how close is that quality health care being placed in jeopardy because of the sheer volume of the cases? I mean, are we still safe as a state in terms of meeting that goal?
Yes, I believe we are still currently in a position to meet that goal, but we have to take steps now to make sure 3 or 4 weeks from now that we are not in that position. That's the reason we have worked with Dr. Dobbs to slow elective surgeries, because what we can't do is have, for instance, 100 ICU beds that should be held for COVID-19 patients that we know are ultimately going to be filled, because we see where the numbers are going, filled with those patients that are have complications from elective surgery. So if we will do the necessary things now, everything from protecting hospital beds, ICU beds, and ventilators through measures that are not popular but are necessary, such as reducing elective surgeries, and individual Mississippians will help slow the spread so that we can also, while at the same time freeing up bed capacity, at the same time work together to slow the spread of the virus. Those two things together can make a huge difference long term. And so what I would tell you is we are not in a position now where quality care is at risk immediately, but we could get there, and we could get there fairly soon. And that's not a dynamic that any of us sitting at this table want to see. And I believe in my heart that is not a dynamic that the vast majority of my fellow Mississippians want to see either. And keep in mind, we're not talking about finding ourselves in a position where quality care is at risk just for COVID patients. That's what I think a lot of people don't understand. There are those individuals who, by golly, I'm not going to wear a mask because I'm young and I'm tough and COVID's not going to affect me. And that may be true for some of those individuals. But if you live in a community that has no ICU beds and there happens to be a car wreck that you're in and you need care immediately and there are no ICU beds and there are no physicians available to treat you, then it's going to affect you too. This is not just for those who are susceptible to COVID-19. The decisions that we're making and the conversation that we're having today, it's always discussed by all of us. No one's in the wrong. It's discussed in terms of what does it mean to COVID patients, but it's not just what does it mean for COVID patients, it's what does it mean to those that will ultimately find themselves in need of trauma care because of an automobile accident or because of a four-wheeler accident in a rural community in Mississippi or because of a heart attack. Heart attacks aren't just going to stop because it's 110 degrees outside and because we have 800 people in the hospital with COVID. Heart attacks are going to continue. And so it's a call to action to protect everyone for those things that we know are going to occur in the short run and those that we don't yet know are going to occur in the short and intermediate term.
I know that we've seen a lot of counties or cities, and I think Dr. Dobbs, you spoke to it maybe in one of your press briefings last week, do their own mask mandates. And I know that y'all talked a lot about local buy-in for some of these additional restrictions. Are you all finding that that is the better way, that it results in more compliance when you have locals buying in rather than doing a statewide mandate?
If you can get the local mayors, the local city councilmen, the local supervisors, the local leaders in the business community, and other leaders in the religious community in a community to say we all need to wear masks, you're much more likely to get compliance than if the governor says it from Jackson. I just absolutely firmly believe that. Now, are there those, there are those who say, well, look, if you just write it down on a sheet of paper, it'll happen. It don't work that way. It hadn't worked that way for the last 4 months. It hadn't worked that way for the last 40 years. It ain't going to work that way for the next 4 hours or the next 4 days. It takes buy-in by everyone in the community. And so what I'm trying to do is implement state orders in such a way that raises the alarm, and I think it has raised the alarm in Hinds County and in Rankin County. I don't think that if we had a state order, if we did not have a state order, that we would have had so many people out handing out community masks in Rankin County over the weekend. I commend them for doing it, by the way. Many of them are my good friends, and I appreciate them, and they did the right thing. And we've got to do that community by community where it makes sense. But there are also areas in our state that have the virus, but it's not nearly as bad. They hadn't had 200 cases. They've had 10 cases in the last 2 weeks. And so differing counties have different groups. Will it continue to help if everyone wears a mask? Absolutely. We've got to figure out a way. We've got to thread that needle of how do we get the best compliance. And I believe that the approach that we're currently taking is the right approach. I'll tell you what I told the mayors and the supervisors this morning on a call. I think we probably had 100 mayors or so, and all 82 counties participate, a number of county officials. If the folks in the local communities want us to add their county, if they get buy-in from the mayors in the county and the supervisors in the county and the countywide elected officials and the sheriff, and they're all committed, come see me. Call my office. We'll probably add you if that's what you want. We've got to thread that needle of how do we get the most compliance, and we believe the approach we're currently taking does that.
Leo with AP has a question.
Thank you, Renee. This is a question for Dr. Dobbs, and I apologize if this was asked earlier. The sound on my computer was malfunctioning. but how many of those 41 individuals that you mentioned that are associated with the legislative outbreak are actual legislators, and exactly how many are other people?
We know of at least 30 who are legislators, and the remainder are others. There's still some others actually we're still trying to verify that might be out there, so it could grow a little bit more. But for the most part, we think we've got a pretty good idea of the total number. Yeah, that's it.
Yes, sir.
Thank you, Governor. In your last statement, you were saying you believe this approach, going to getting local buy-ins, is the best approach. Yet we're still seeing hospitalizations constantly surge. We're seeing ICUs almost down to at zero in many places. It just looking at the numbers, it doesn't seem like it's the best approach. How do you want to try to keep selling this to eventually see a decline if it is the best way to do it?
What I would tell you is much of what we're seeing in our hospital system today is a direct result of what happened in Mississippi 4 weeks ago. So it's individuals that had the virus that then went and spread it to one iteration, and now we're going to the second iteration, and that's what's really causing the numbers to continue to rise. So if we had 100% mask compliance tomorrow, if you believe that masks were the end-all be-all, and by the way, let me be clear, simply wearing a mask does not guarantee you're not going to get the virus. Wearing a mask with 6 to 8 feet of social distancing, outdoors, all combined significantly minimizes the risk, but there's still risk. But if you believed that simply wearing a mask would stop all transmission, I would submit to you that for the next 7 to 10 days, if we had 100% compliance today, for the next 7 to 10 days, the goose is already cooked. The numbers that we're going to report tomorrow and the next day would not be significantly impacted or affected if 100% of the people wore a mask today. These things take time and iteration after iteration. Now, if we had 100% compliance of mask wearing and people socially distancing today, it would significantly impact the numbers 15 days from now and really significantly impact the numbers 30 days from now. But that's the nature of a virus. That's the nature of a pandemic. We live in a society where instant gratification is the norm. That's the way so many people think today. That ain't the way viruses work. There is no instant gratification. The little things that we do today can significantly impact the numbers 15 days from now.
Bruce with the Heckinger Report has a question.
Great.
Hi, I have a question for Dr. Dobbs. Right now, districts have a lot of flexibility in determining how they reopen, which makes sense if one county has infection rates, of new cases in the single digits, and in another county it's triple of that. But what I wanted to ask is, is your department looking at issuing benchmarks, for example, that might give guidance, such as if daily infection rates in your county reach, X, you need to be proactive and go ahead and switch to remote learning until they curb again? Or is that decision solely going to rest with superintendents and school board?
That's a great question. Our role at the health department, we've worked pretty closely with them to define kind of what we can do for them, and the three things that they really wanted for us to do was to help them if they have cases or outbreaks and give them guidance. And we have documents that we will share with them, but we've already given some early guidance. They also want us to give them decision tools to how to operate different parts of the school better. We've done that to kind of help, and it melds well with the CDC guidance, and we use a lot of information from CDC Foundation. And the third thing they want us to do was help them with some of these big ticket items, like what's a stadium for football? What's that look like? And because they wanted some uniformity. We are here to help guide them, but in Mississippi, the districts have a lot of autonomy, and we will be here to help them. Although we don't have any preset triggers, it's bad right now. It's probably going to be pretty bad going into the fall, but we do feel like even when it's kind of bad, like it is now, there are things you can do to be safe. And so it's not like going straight to online. It's just making sure that you're doing every little thing as precisely as possible as far as, it's the distance, it's the mask, it's the group size. You can't manage that all the time. But really, in almost any scenario, if you're and we've seen this in other countries that have the discipline to do it properly, that kids can go back to school safe. Some things you can't do safely. You can't have a pep rally safely. That's just not safe if you're going to have everybody crammed together. So those are going to be the bigger decisions, I think, is what you choose to do and not do, and then the balance of online learning and in-person learning that meets the best needs of the students.
And I will just simply add that we want to give much deference to our local school boards. That's the way we run education in Mississippi. But much like I did in March, if it becomes necessary that we step in and issue an executive order, which binds all schools to a certain approach, we will not be hesitant to do so. I've told you the hardest decision I made as governor in March was when we shut down schools. I don't want to do it again if it becomes necessary to either shut them down or to open them based upon the data. And working with the health department and working with Dr. Wright and her team, I will do whatever is necessary to protect our kids, put them in a safe environment, but also do everything we can to make sure that they can grow up to be productive members of this great society. So that appears to be the last question. We've been here for an hour and 20 minutes. I want to thank everyone for being here. I want to implore all of my fellow Mississippians to continue to work hard, continue to work with us to make this place safe, and stay safe, be smart, and God bless.